driving and being drowsy, right, Tara?
Well, yes, Leah, funny you should bring that up. December 1st through the 7th is National Safe Driving Week. So we thought we'd shed some light on one of the primary but little understood causes of fatal collisions in Alberta. We're talking about driver fatigue. Here to explain what it is and what you can do about it is Dr. David Merrell. Dr. Merrell, welcome. Thank you for coming in.
Good morning.
Okay, so let's talk about how prevalent this problem is. How many of us are drowsy driving?
Well, they estimate that 20% of collisions are due to fatigue and drowsy driving, and the studies are showing alarming and increasing rates as we're getting more and more aware of ways to detect the problem.
20%. That's
20%.
A huge percentage.
And the rate of fatalities is actually higher for drowsy driving than some other matters, such as alcohol-related collisions.
Okay, so explain to us, I guess, how this actually affects us, because I think a lot of us go about our day, we're a little bit tired. We don't actually understand how it impacts our lives or our motor skills, for instance.
Lack of sleep or poor sleep will cause fatigue. And if, for example, if you go 19 hours without sleep, the fatigue that you develop and the loss of mental acuity is equivalent to 0.08 alcohol impairment.
Which is the legal limit.
The legal limit.
Which is the legal limit.
That's right.
Wow.
And the greatest cause of poor sleep or poor quality sleep is actually snoring.
Is actually snoring. Okay, so for those of us who may snore a little bit throughout the night, are you talking to us or are you talking to people who may have more significant problems?
Well, there's well-documented research that shows that if you snore, even intermittently and softly, that you are at 3 times greater risk for automobile accidents.
Well, why?
Snoring is actually impaired breathing. If we don't breathe properly, we're not going to be very healthy. And even if the breaths of only, let's say, 10% of your breaths during an 8-hour period of sleep are impaired, there's a lot of research showing that health-related issues arise from that.
I'm shocked to hear that because I sort of, I read this and I think, well, this must apply to people who are shift workers. And so you're saying that just the average adult may have some sleep issues that we're not even aware of.
That's correct. 40% of adults use separate bedrooms because of snoring issues. And 60% of adults snore. So that's a lot of people. And again, the percentage keeps growing every year with more and more research.
Wow. Okay. So what do we do about it then?
Well, the Canadian Thoracic Society, which is all the breathing and sleep specialists in Canada, have published guidelines on the internet. And they say if you snore or have mild or moderate sleep apnea, the first line of treatment is actually a dental appliance. And there's an example here I brought along.
Okay, so I guess what is sleep apnea exactly and what does that do?
So snoring is narrowing of our airway at night. And sleep apnea is complete closure of the airway, which results in drops in oxygen and stressing our body. So if you use a dental device, it keeps the jaw slightly forward and allows you to breathe better at night, prevents the tongue from closing the airway. Better breathing, you're going to be more healthy, you're going to get a proper night's rest.
So how do you know if you have what is classified as sleep apnea?
Well, if you snore, most likely you have a little bit of sleep apnea. But you can go online on our website, merrellclinic.com. There's a simple short form self-assessment for snoring and sleep apnea. If you tick 2 or more items, you've got a over 90% likelihood of having significant sleep apnea.
Wow. And you want to nip this in the bud, right?
Yeah, get a simple home sleep test, find out if you have disordered breathing, and then get treatment because you're going to live much longer, have less health consequences, be happier, and your spouse will be less irritated.
Yeah, they won't kick you out of the bed. Thank you so much for this information. We'll make sure we have the links up on our website at breakfasttelevision.ca. Dr. Merrell, thank you very much.
You're welcome.
All right, well, hopefully everybody's alert heading out there on the roads this morning. Dave, how's it looking?
Well, overall, a pretty good drive this Friday morning, Tara, 8:18.